Hello professionals, this is Dr. Saad, and as you know, I'm recording series of lectures for pharmacists who are going to appear for international equivalency exam. So the new viewers are requested to go and watch our previous video so that you can get about our preparation strategy. So let's resume our topic, that is the autonomic nervous system, and today we will discuss various points. So let's start. Point number one is about some drug that is known as the levodopa isoproterenol and isobutyl bromide. Levodopa is an alpha and beta blocker, and it's a non-selective. Isoproterenol is a beta 1, beta 2, beta 1 and beta 2 agonist, and is used for bradycardia. We discussed it in previous video. And isobutyl bromide is a drug specifically used for antispasmodic. It's an anticholinergic drug. Point number two is about the GABA. Gamma aminobutyric acid is an inhibitory neurotransmitter of central nervous system, and it is produced by the glutamic acid combination with the vitamin B6. So if vitamin B6 level drops, so it will affect the production of GABA. So this was the point. Point number three is about the vagus nerve. As you know, it's a main nerve of parasympathetic nervous system. It controls digestion, heart rate, and immune system. Point number four is about the epinephrine, why we don't use it for the management of respiratory issues like asthma, only because of its non-selectivity. We will prefer to avoid non-selective drug as a drug of choice or in our therapeutic application because it causes side effects. So point number five is about the atroponium. Atroponium is an acetylcholinesterase inhibitor, just like as we read about the neostigmine, physostigmine, and ecothiopate, that is physoline. And this is an acetylcholinesterase inhibitor, and it's actually used for the diagnosis of myasthenia gravis. And as you know, myasthenia gravis is a drop in cholinergic level which causes the paralysis and exhaustion or fatigue of skeletal muscles. So it's caused like Parkinsonism like symptoms in which slow of movements and rigidity and tremor. So this is also defined as the myasthenia gravis is also known by the cholinergic crisis. So atroponium is a drug which is used for its diagnosis. Next point, that is about the glaucoma. Glaucoma, as we discussed about in meiotic agents, glaucoma, open angle glaucoma is being used, we use uh, acetylcholine enhancing drugs or enhancing drugs for the management of open angle glaucoma. Similarly, astropenia is an condition in which misalignment of eye, one eye is diverted inward. This is known as astropenia, and glaucoma associated with this astropenia is being managed by the drug that is known as demicarium. Demicarium is also an acetylcholine esterase inhibitor. It is also used for open angle glaucoma, astropenia, or glaucoma associated with aphakia. Aphakia is a condition in which surgically or any with surgically lens of eye is being removed, and in that patient, if glaucoma is reported, this is being managed by the use of demicarium. Point number nine is about the dantrolene, baclofen, orphendrine, and cyclobenzaprine. These all are muscle relaxants. But what is the difference between them? Dantrolene is a centrally acting muscle relaxant, but on the other hand, baclofen, orphendrine, and cyclobenzaprine is a peripherally acting muscle relaxant. This is the difference between them. Cyclic AMP. Cyclic AMP is not a neurotransmitter or neuromediator in CNS, but it is a secondary messenger. Neurotransmitter of central nervous system is two neurotransmitter is same as in the peripheral nervous system, that is acetylcholine and noradrenaline, commonly known as norepinephrine, and with the two additional neurotransmitters that is serotonin and dopamine. So cyclic AMP isn't a neurotransmitter, but it is a secondary messenger. Next point, that is about the isoprenaline. It's a structure related to the epinephrine, but it isn't metabolized by the COMT enzyme. So it is used for the management of hypertension. That is the point. So point number 12. So why I told about this, because epinephrine is being broken by this enzyme, and this drug iso isoprenaline isn't broken by the isn't catalyzed by this enzyme, so it is used for the management of hypertension. Point number 12 is about the competitive inhibitor and non-competitive inhibitor. Who will more inhibit? Definitely, competitive inhibitor is going to inhibit less, and non-competitive inhibitor will going to inhibit more. This is all about it. Point number 13 is about the CNS mediator. We have discussed about the dopamine serotonin. Point number 14 is about the cholinergic crisis, which is how we have discussed with the adrophonium in previous point. Point number 15 is about some two drugs again, carbapenem, colchicine, acetylcholine, you can say cholinergic drugs. So just have an just you need to know about its classification. Point number 16 is about beta agonist mode of action. Beta agonist, as we discussed in a previous video, it activates adenyl cyclase, which produce cyclic AMP, and it allows calcium inward flow, and in the result it causes positive inotropic effect, or you can say, as you know, inotropic effect is the increase the force of contraction. So beta agonist causes positive inotropic effect. Point number 17 is about atropine side effect. Atropine is an anticholinergic drug, so it will block all cholinergic action. Like in eye, it will cause blurred at gastrointestinal tract, it will cause constipation, and at skin, it will stop this salivation, at sweating, and in bladder, it may cause the retention of urine, and similarly, all those areas where cholinergic response happens, atropine will block its response, and in mouth, it will cause xerostomia, which is the decrease in the salivary production, saliva production. So this was all about this atropine side effect. Next is the doses of anticholinergic drug. This point is linked with the previous point. Let's discuss that is the so this is a condition known as motion sickness. Just remember this is motion sickness because of this patient feel vomiting. Here we use muscarinic receptor to block this effect. That's example which the drug which we use for it is this scopolamine, the dose of 0.4 mg TDS. Secondly, there is a disease known as IBS, irritable bowel disease. Here we also use the muscarinic receptor, and the drug which we choose for it is the dicyclomine with a dose of 10 to 20 mg QID. It actually antagonizes the action of cholinergic acetylcholine, so we are getting it as our therapeutic objective. Atropine, you are well acquainted with this. Its dose is about 0.4 mg TDS or QID 4 times per day or 3 times per day. Next, there is a disease known as the urinary incontinency. This is the problem in some patient where frequency or incontinency or nocturia happens. So to manage these patients, we use anticholinergic drugs. That example is this scopolamine with a dose of 5 mg OD, and tolteridine with a dose of 2 mg BD. Sorry, scopolamine we use once per day, and tolteridine we use 2 mg BD, and oxybutyrine is a drug we use 5 mg TDS for the management of urinary incontinency. So you will just observe that we are using our receptor, and we are modulating neurotransmitters action, and we are getting our therapeutic objective. That's all which we use in all autonomic nervous system. Atropine antidote. Point number 20 is about the atropine and palidoxin. As we discussed this point about in the organophosphorus poisoning, it acts as an antidote if anything happens and for emergency situation. Point number 21 is about the stimulation of sympathetic nerve. It will definitely going to cause the contraction of smooth muscles. Point number 22 is about the ACE inhibitor and similar structure. I just want to tell you that acetylcholinesterase inhibitor is inhibitors are drugs that is the physostigmine, neostigmine, hydrophonium, demicarium, and cothiophate, for this is also known as fasoline. These drugs have the structure similarity with acetylcholine, but acetylcholinesterase can't split them, and it actually engage the acetylcholinesterase, which ultimately leads to increase the level of acetylcholine, and we use it as our therapeutic goal. And same effect is being used for in insecticides, and but it as we I tell you in during the topic of organophosphorus poisoning, but it also act as a poison if it is human get exposed by this drug. So this was our point, and remaining point will be discussed in next video. Thank you so much for listening, and please subscribe our channel if you feel that our this effort is going to helpful for you. We here try our best to only extract those specific key points which can be asked in exams. See you in next video.